Member from Cowichan Valley.
Thank you, Mr. Chair. I have a few questions for the Minister. The first one is very specific to my riding, my constituency, and we are delighted that the Cowichan District Hospital has been approved. We're very excited about that. But in the meantime, the challenges remain for the current hospital. And the Cowichan District Hospital Foundation has put money forward in order to solve one of the highest needs, which is to make space for new beds by moving the administrative offices outside of the hospital so that that space can be used for beds. The Cowichan District Hospital Foundation has not yet received confirmation from Island Health that this project will proceed in the terms that was outlined in the March correspondence between the Foundation and Island Health. And in addition, it's the understanding of the Foundation that the government is not going to contribute financially to this project. It will be the Foundation and the CVRHD. My constituents are of the view that there should be a contribution from the provincial government as we have the needs to be served at this hospital, which has been over capacity for several years now, and I think very rarely is not over capacity in terms of beds. So I'm wondering if the Minister is aware of this project brought forward by the District Hospital Foundation and if the provincial government can help to support it.
Minister.
Thank you very much, Honourable Chair. It's really good to see you this afternoon. Thursday afternoon is my favourite time. And talking about Cowichan District Hospital is also obviously a positive thing to do. I know the member has been working and supporting this project, and it's the hospital replacement is obviously critical in Vancouver Island. You don't have to spend much time in the hospital to know that the staff does an extraordinary job in the existing facility, but that the replacement is needed, the replacement is coming, we're working on it together, and the business plan development is underway. With respect to this issue, which is not really, which hasn't come to the attention of the Ministry of Health, but would be an issue presumably between the Foundation and Island Health, what I'm going to do is ask, and hopefully we'll get a response really quickly to get an update on what Island Health's intention did. It wouldn't come from the same capital funds that we're replacing the hospital with, which is a provincial question. Should Island Health participate? And I don't know if they will or they won't, but I'm going to get an update that would come from their maintenance and minor capital funds.
Member.
Thank you, Mr. Chair, and thank you to the Minister for that. That will be helpful. I have another constituency based, and this is something that came into our constituency office. So there was a case of in Duncan of a mother, a Cowichan woman whose mother was suffering from dementia and living with an in-law who requested that she be admitted to a care home immediately. In this situation, the case manager offered a spot in Parksville, which is quite a distance from Duncan, and the in-law delivered her mother-in-law to the facility against the wishes of the rest of the family. And so the problem with this situation was that the in-law did not have power of attorney to make this decision, and the case manager in this situation didn't seem to require it. So I just have a couple questions around that. Is it typical that a person without power of attorney would be allowed to make a decision for someone else's health choices? And what is the process that's in place to, if this is not typical or not acceptable, is there a process to make sure this doesn't happen in the future and remedying this type of situation? And then the broader question about the placement of seniors in facilities that are close to their families, is that a priority and how do we make sure that that happens?
Minister.
Thank you. And the case, the particular case, is obviously involves privacy issues for everyone involved. But what I can commit, and the member may well have done this already, but I'm not aware of it. I can commit, if he wants to share the details of the case, that we can go over it and assess that. There is a place to complain, of course, about health authorities and so on, which is to the patient care review boards and that process that carries on if there's a complaint to be made by somebody. But we can also review the circumstances, and I'd be happy to do so on behalf of the member's constituent and on behalf of the member.
Member.
And thank you to the minister for that. And just to follow up, just in terms of the power of attorney question in a general way, would it be typically understood that the decisions around somebody's health or placement would lie specifically with the person who has power of attorney over that person, over the person whose the decisions are being made about?
Minister.
Just to, obviously, and this has been a positive evolution over time, the development of advanced care directives to assist in people's interaction with the healthcare system and ensure they have agency and voice when they can. When that's not the case, of course, there's challenges. Just to be clear, if you're looking at these agreements, representation agreements, name someone to make healthcare decisions if you become incapable. The advanced directive itself, of course, provides instruction about healthcare treatments you accept or refuse, and the enduring power of attorney appoints someone to make decisions about your financial affairs, business, and property, but not healthcare treatment decisions. So those are some of the distinctions. Again, with respect to the members' constituents, we'd be happy to look at the circumstances, whether mistakes were made or not made, and what the circumstances were, and I'm sure respond directly. As always in these patterns, require consent and all those other things, but to get into that, but we'd be happy to look at the details of the case to see how all of those things applied in this case.
Member.
Mr. Chair, and thank you to the minister again. Slightly different, the Emergency Health Services Act. And my first question is actually just to make sure I have a correct understanding of this. So it is been brought to my attention that the Emergency Health Services Act, brought in 1974, makes it illegal for most of BC's first responders or medical professionals to render care beyond, quote, first responder level, industrial first aids, while they are on the job outside of a hospital. Can the minister confirm that this is indeed the case of this legislation?
Minister.
Thank you very much, Honourable Chair. Essentially, the member is correct. The legislation allows paramedics to work as paramedics to their full scope when they're working as paramedics. That same person, if they were working in some other area, say they were, which is not infrequent, working in an industrial plant, working even as a firefighter, they would not, under those circumstances, be treating to that scope of practice. There are some nuances to that, but the member's position is essentially the right one, and that is enshrined in legislation.
Member.
And so, then my understanding is also, so the Act makes it illegal for any non-QP 873 member to transport any patient to a hospital. And that, so what we've heard is that this is a problem because first responders like firefighters, police, search and rescue professionals can't provide this transportation to a hospital unless there is an agreement beforehand. And furthermore, no doctors or nurses can step outside of a hospital to render care while they are on a job. And so once again, if the minister could confirm that this is the correct understanding, and then further to that, does the minister consider this act to be in the best interests of British Columbians?
Minister.
I think, first of all, it's absolutely not related to the union. And so I think I would sort of disagree with that characterization. It's related to the level of training and licensing. So the first level of licensing for emergency medical response, you're not allowed to transport. The second level, where all ambulance paramedics are, you are. There are some exceptions in British Columbia and some remote areas where others transport. Generally, it's ambulance paramedics. In addition, nurses in certain high acuity circumstances can do work with paramedics and can play a role as well. But essentially, it relates to the level of training and not to any membership in any union.
Member.
Okay, thank you for the clarification. And so the minister mentions that there are some exceptions, and particularly I would expect in underserviced areas of the province, rural areas. Does he have examples of that? And in terms of getting those exceptions, is there a process for those exceptions to be brought in if a region is determined that they would need that kind of flexibility or those kinds of exceptions?
Minister.
There's one exception which is, I think, unique in the province, which is in Kitimat, where fire does all paramedic services. And the other exception we identified is in some First Nations communities where your transport to the territorial border of the community be relevant. If people would be interested in that, those are all worked out with BC Emergency Health Services if required, and they're, as suggested, very unusual cases.
Member.
Thank you. On to a different topic now. Cataract surgery wait time. So this is more of a regional question, but 2013, the average time for somebody needing cataract surgery at the Regional General Hospital in Nanaimo was 27.9 weeks. It's now 61.3. And I've heard a lot from constituents who are quite concerned about this wait time. Can the minister give me any information about what's being worked on to reverse this trend for cataract surgery in Nanaimo?
Minister.
I have some regional data for the member about the last year, where we've made some considerable progress, and I'm prepared. We'll certainly ask for some site-specific information and share it with the member. As the member will know, under our surgical and diagnostic strategy, we've significantly increased the number of surgeries overall in BC. Determinations about priorities are generally, we have some priority areas where we funded, which were hips and knees and dental surgery this year, but other than that, those priority decisions are obviously made by health authorities and largely their medical teams. On Vancouver Island, cataract surgery wait times have seen significant decreases in the past fiscal year. That year is 2018-19. The 50th percentile decreased by 22.2%. The 90th percentile decreased by 18.4%. I've asked them to get the data here. On Vancouver Island, we completed 511 more cataract surgeries in 2018-19 than the previous year, which is a 4.2% increase.
Member.
Thank you, and that's very helpful as well. It's good to hear. The next topic I've got is inflammatory bowel disease. And I'm sure the minister is aware of the devastating personal and healthcare impact of inflammatory bowel disease. About 25,000 Colombians of all ages are struggling with IBD. It is a costly, non-curable, complex, lifelong disease, and because it often presents as young people enter adulthood, many of them are seeing their educations and their careers sidetracked. And there are 1,500 new cases diagnosed every year. So my first question would be to the minister, could he explain how the ministry and the healthcare system are tackling this challenging and chronic disease?
Minister.
Thank you very much, Honorable Chair, and thank you to the member. Obviously, this is a condition that afflicts many people in BC. The association representing patients and in part clinicians has met with the ministry in the last few months to discuss initiatives that they would like to see taken, and those are obviously under review. They'd like to see, just as an example to the member, the creation of a new center at St. Paul's Hospital. They had a fairly significant ask, it should be said, which I think was for $5 million. We haven't approved yet, but that's a proposal that they've made to make some advances in this area. Obviously, it's the health authorities in general that respond to and do respond in this area and others to provide care. If additional resources are required, that is directed by clinicians in the hospital, in the health authorities making decisions about about priorities, but people should expect treatment, and obviously the quality of primary care and other supports is critical to that, and that's why we're trying to improve primary care for everybody. So there are some specific proposals, and there have been specific discussions, and it's something that's under review.
Member.
Thank you, Mr. Chair. Just in terms of those specific proposals and discussions that are coming forward, is there a timeline that can be expected in terms of when the ministry would be engaging or coming up with decisions on that?
Minister.
Thank you. Of course, the timeline now is the provision of care now. This is a significant issue, and that care is being provided, and there will be a discussion about whether that's adequate. What I think is being asked for is a form of center of excellence in this area to drive the issue, and that request has been made, as were other requests. It's the reason we met with the group, as we do frequently with groups of patients who have particular interests in the healthcare system, and members of the legislature meet with them as well frequently, but our ministry meets with them in a more kind of substantive way. Not to say that our meetings aren't substantive, but in a more substantive and specific way sometimes about specific treatments provided by health authorities, not sort of general discussions. But the proposal was put before us. It's quite an expensive proposal, and new, but it's something that an issue we take seriously and we'll be taking a look at. Historically, such proposals get funded, have been funded at year end. You know, to a degree, we're trying to move away from that area. You'll know, the member will know, and I think the member from Colonial Lake Country will be asking about this later, that at year end, for example, we funded the First Link program again this year for the Alzheimer's Society, and that was $2.7 million, which has consistently been funded at year end over a number of years. And ultimately, I think it would be healthier and better for the society if it was in the base, so we didn't have this sort of the tension that sometimes surrounds year end funding. But this would be, I think what the request is for was $5 million in one-time funding to establish the center, and I presume that there would be ongoing costs. And that proposal was before it came forward for the first time, and so it was a subject of the meeting, as were other issues of the groups involved. So there would be also operational or delivery issues which really don't involve the creation of a center necessarily, and so that's the ongoing work of the ministry with both with the group and on the issue.